Today, we're diving into a really important topic: how to care for a loved one with dementia, especially when you get to that stage where words start to fade. Our goal here is to give you some practical tools and, hopefully, a little more confidence for the road ahead.
This is the big question, isn't it? It's the one that probably keeps you up at night. When the person you love can't tell you what they need or how they're feeling, how do you bridge that silence? Well, that's exactly what we're going to break down. So here's our game plan. We'll start with getting our mindset right for this new reality. Then we'll get into the practical, day-to-day tools you can use. After that, we'll learn how to decode what their behavior is telling us, how to handle those really tough moments, and we'll finish up by talking about your most important role in all of this.
Okay, first things first, we have to kind of reset our own expectations. The old ways of talking and interacting just might not work anymore, and you know what? That's okay. This is all about building a new foundation for care, and it starts with a fresh set of principles. Think of these 5 principles as your new North Star. Honestly, everything you do should circle back to these. Safety is just non-negotiable. Their dignity is everything. You're going to find that a good routine is incredibly comforting for them, and your own calm energy is way more powerful than trying to control a situation. And please, remember to let go of being perfect. Flexibility is your new best friend.
So this is the big mindset shift we're talking about. We have to move away from trying to explain everything with words. The new way, the effective way, is all about becoming a great observer. It's about using a gentle touch to say, "I'm here," using repetition to build comfort, and showing them what to do instead of telling them. You're basically learning to speak a whole new language, one of action and presence.
All right, now that we have that foundation, let's start filling up your daily toolkit. This part is all about the practical, hands-on things you can do to make their world feel safe, calm, and predictable.
You know, a predictable rhythm to the day is one of the most powerful tools you have. It just takes away that whole "what's happening next" anxiety. A gentle start to the morning, some simple activity midday, and a calm wind down in the evening. It creates a structure they can lean on. This isn't a rigid military-style schedule. Think of it more like a comforting, predictable flow.
What's so incredible here is just how much you can communicate without saying a single word. Making eye contact and offering a warm smile says, "You're safe with me." Moving slowly and deliberately prevents startling them. And what you don't do is just as important. Long, complicated explanations are just confusing. Sudden movements can be scary, and too much noise or activity can easily lead to agitation.
Okay, let's talk about hygiene, because this can be a real point of stress for everyone. Here's a simple 4-step approach. First, get everything ready beforehand. Make sure the room is warm, towels are within reach. Second, show them, don't just tell them. Mime washing your face. And third, you can use gentle hand-under-hand guidance, but, and this is the most important part, if they resist, you stop immediately. You don't push it, you just try again later. Their comfort is way more important than getting the task done right now.
All right, this next section is a total game changer. We're going to shift our thinking completely and start seeing challenging behaviors not as problems, but as their way of communicating with us. It's time to become a detective.
This right here is the core idea. When someone with dementia can no longer find the words for "I'm scared" or "I hurt" or "I have to go to the bathroom," their behavior becomes their voice. Every action, even the ones that seem random, could have a meaning. Our job is to learn to listen with our eyes.
So let's look at some real-world examples. If they're pulling away from you, it's not personal. It could just be fear or discomfort. If they seem restless, it's not just fidgeting. It could be an urgent need, like the toilet, or maybe they're in pain. Agitation is often a huge sign that they're just overwhelmed by too much stimulation. Once you start decoding these signals, you can respond to the actual need, not just react to the behavior.
And this brings us to one of the most critical things we have to talk about, something that gets missed all the time. Before you assume any difficult behavior is just part of the dementia, you have to stop and ask yourself this one question. Could it be pain?
Since they probably can't tell you what hurts, you have to look for the clues. Watch their face. Are they grimacing or clenching their jaw? Notice their body language. Are they guarding their stomach or a sore hip? Listen for new sounds, like moaning. A sudden burst of agitation or refusing to do something they normally do can be a massive red flag that something hurts. So here's the super simple but really vital rule of thumb. You don't have to be 100% certain. If you see 2 or more of those signs, let's say they're grimacing and they're guarding their side, your new default setting should be to assume pain is there and start looking into it. This simple check can make a world of difference.
Okay, now let's get into those moments that can feel really overwhelming. This section is all about giving you a clear-headed guide for what to do when things get stressful, so you kind of have a plan in your back pocket before you even need it.
You've probably heard of sundowning, that late afternoon or evening time when confusion and agitation can get worse. The key here is to lower the stimulation. As it gets dark outside, turn on some soft lamps inside to get rid of scary shadows. Try to limit long naps during the day so their sleep schedule doesn't get too out of whack. And most of all, just your calm, reassuring presence can be the best anchor for them.
In any high-stress situation, I don't care if it's agitation, refusal, anything, your first gut instinct is probably to react fast, to do something. But the single most powerful thing you can do is to just stop, take a breath. Your calm is absolutely contagious.
Think of this as your mental roadmap. So, first, you stop. Then you run through this quick checklist. Are they in pain? Do they need the toilet? Are they hungry or thirsty? Then observe their nonverbal cues. Respond calmly to whatever you see. If things are still tense, try to gently redirect them to something else, something simple and pleasant. And you know what? If it's just not working, don't force it. Just try again later.
We're at our final section, and honestly, it might be the most important one. After all the practical tips and tricks, let's zoom out and talk about what your role really is at the heart of all this. Your job is not to be a taskmaster. You are a guide, helping them navigate a world that's become confusing. You're an observer, listening with your heart and your eyes. You are their source of calm in the storm. And please, remember, you can't pour from an empty cup. Taking breaks and asking for help isn't selfish. It's an essential part of being a good caregiver.
If you only remember one thing from our entire time together, please let it be this: connection is greater than correction. Maintaining that warm, loving bond between you is always, always more important than correcting a mistake they made or getting a task done perfectly. That feeling of being loved and safe, that's what truly matters.
And finally, I just want to leave you with this thought. What you're doing is some of the hardest, most meaningful work there is. It can feel invisible sometimes, and you might not get a lot of thank yous, but please know, deep down, that it matters more than you can possibly imagine. You are their anchor. You are their safety. You are their person, and that is everything.